think it's important to recognise that the side effects of treatment have now become paramount for a lot of these men. We have a number of different treatments and so on. A lot of them demonstrate very good oncological efficacy, i.e. we can get rid of the cancer for you, but you're then left with considering, well, what are the side effects that I'm prepared to tolerate for this? Now, traditionally, radical prostatectomy was considered to be quite a morbid procedure, and relatively speaking, it is still a morbid procedure. We're talking about figures, and different surgeons will quote different figures, but the average figure that I quote for men being incontinent at 1 year is about 10%. Some men will have slightly less incontinence than that, some will have more than that. But I warn all of my patients that there might be a bit more leakier than that to begin with. But if you evaluate men at about 1 year, the consensus is of about 10 to 15% figure. So that's the risk of incontinence. We know from our medium-term data at 5 to 6 years with focal treatments such as HIFU, that risk is about 1 to 2% in men for incontinence. If we look at the other major morbidity, if you like, following these treatments, and that is of erectile dysfunction or impotence, as it's commonly known. The risk of that following a radical prostatectomy varies depending upon whether the surgeon can spare nerves or not, whether he can spare nerves on both sides, or whether he can spare nerve on one side, or whether he cannot spare the nerves at all. If he cannot spare the nerves at all, there is effectively 100% chance that that man will be impotent. If he's got unilateral nerve-sparing procedures, then despite again what some surgeons say, and I deal with the other side of this in andrology, there is about a 2/3 risk that he is still likely to be impotent. With bilateral nerve sparing, that figure goes down, but it's still of the order of 30 to 50% of men will be impotent even with a nerve sparing procedure.